Hi, everybody. I'm just going to give a minute or two for people to get logged in. And while we wait, just invite those of you who are already connected to just get yourself comfortable. We're going to be doing emotional self-care for the clinician today. So just set up your environment and your body position to be in the most comfortable state as possible, whether you're joining on a lunch break or from home, just to take a moment to set yourself up to be comfortable. And we'll just let people get logged in for a moment or two. Okay. So we've got a lot of people logged in. I'll just start by introducing myself as other people get logged in and comfortable. My name is Sheila Plutzi, so I am co-director of Mental Health Foundations, and on behalf of Mental Health Foundations and the International Institute for Emotion Focused Family Therapy, welcome everybody to this webinar today. I am located in Sault Ste. Marie, and as also in part of being co-director for Mental Health Foundations, I also have a private practice here in Sault Ste. Marie where I offer individual, couple, and family therapy. I have a master's of social work and a registered social worker, and also am a certified Reiki practitioner. So I welcome everybody today for this webinar on emotional self-care for clinicians. What I'll do is a bit of, there we go. Kind of to go through the agenda for today. So we have an hour together, and what my intention is to focus more on how to be than on what to do when it comes to self-care. Being in this field, many of us are aware of what it is. We often teach it to clients. So today I wanted it to be more of an experiential process that we can engage in together. And what I do encourage is to have a pen and paper at hand. So I'll give you just a moment to get whatever, those materials, and it will be integrated into some of the experiential things that we do. So I'll be asking you to write down your responses to some things. And then with regards to Q&A, I can see when there are questions. So if you notice, there'll be a little Q&A box. I believe it might be at the bottom of your screen. Mine is at the top bar. But if you click on that, you can type in your questions. So I will do my best to answer them as we go, but I will also save a little bit of time at the end of the hour to attend to any questions that have come up over the webinar. So before we get into any of the material, I'm going to invite you all to just to close your eyes for a moment. Get your body in a comfortable position and just connect to your breath without having to change its rate or its rhythm or its depth. Just being aware of how the oxygen feels entering your body and how it feels in the exhale. And just settling into your body and bringing awareness to the breath. And I'm going to go through a small series of questions. And what I encourage is, if you keep your eyes closed as I ask these questions and to try to receive the answer as opposed to searching cognitively for it. And then if your mind is wandering at all, because you've had a busy morning or a stressful morning, just bring your focus and attention back to my voice and my breath. And then after each question, I'll give you a few moments to write down whatever your response was. So the first question is, why did you sign up for this webinar today? And just take a moment to connect to yourself and receive that answer. Not needing to force it or rush it. And when you receive the answer, you can write it down on your paper. And if the mind starts to get a little chaotic, again, just bring your focus back to your breath and ask the question again. Why did I sign up for this webinar today? And write down whatever comes. And I'll just give you a moment to write down your responses. And then inviting you again to close your eyes, connect to the breath, and to ask the question of yourself, what am I hoping to get in this hour today? And just trying to receive the response. There's nothing that's right or wrong. Just whatever is true for you. Using the breath to keep you grounded and in your body. And whenever you receive the answer, to write it down. And then again, once you have your answer or your response written down, to close your eyes. Again, to connect to the breath. Bring your awareness to your body, just quieting the mind. And then asking yourself, what do I need in the domain of emotional self-care? And trying to receive whatever the response that is true for you is. If the mind starts to search for the right answer, just reconnect to the breath and just try to receive the response more from your body and your brain. What do I need in the emotional self-care domain? And write down your response whenever it comes. And again, I'll just give you a few moments to receive your response or write it down. And if you already are completed, just continue to stay connected to your breath. Reflect on your responses. And just get yourself in a comfortable position and situation. Okay. So now that you've all had an opportunity to check in with yourselves and kind of situate and ground in what brings you here today. I'm not going to spend a whole lot of time talking about what self-care is. Mostly because I believe, because we are in the caring profession, a lot of us have a good sense and an intellectual understanding of what self-care is and why it's important. And they are two simple words with such a large concept and many domains. So I'll go over the different domains of self-care in a few minutes. But what today our focus is going to be on is emotional self-care. We are often working in, agencies or practices that are busy and overwhelming, and sometimes we can kind of forget to connect with ourselves and check in with ourselves in terms of what we're needing. So one of the main things that I believe is important to self-care is the self-awareness. We're human. We avoid our emotions too. Sometimes when life is hectic and busy and we have a huge caseload and expectations, we don't always check in with the self. So through many of the things that we go through today, I'm going to incorporate that self-awareness, how to check in with ourselves and ground ourselves so that we can, be aware of what we're needing and be able to connect to and ask those questions of ourselves. So to review the different domains and the dimensions of self, we have our physical selves. That is, could include our exercise, our sleep, our nutrition, just the physical body and its energy that we feel. We have the intellectual and our mind, how we think, how we process information, all of those sorts of things. The social domain, our sense of belonging, whether it's, in our work environment, our families, our social connections, our community, even just our sense of belonging universally. We have our spiritual domain, and that is not always necessarily connected to religion, but it's just could be our sense of oneness with nature, our beliefs in anything about the universe or energy, or it could be rooted in a specific religion and our faith. And then the one that we're going to focus on today is the emotional domain. And that is, how we experience emotion, how we work with emotion in terms of, our clients and what their struggles are, and then also just how we process it. So one of the things that I know I've struggled with in this profession is burnout at various stages. And so I've, made a list of some of the reasons why we burn out, but I also invite, if you want to access that Q&A bar, to provide a bit of feedback. If you've noticed other reasons that have created burnout for yourself. But some of the main ones, difficulties with boundaries. A lot of us are super feelers, which I'll talk more about in a bit. But that expression of assertive anger, often we feel as though we need to do everything for everybody and be the caretaker, and try to manage everything for everybody else and help them achieve their wellness goals, or help them overcome their symptoms. And at times, we might neglect kind of what we're needing, whether it's saying no or just, setting a limit on our client list. So that can be one of the main reasons that we experience burnout, is the difficulty with setting boundaries for ourselves. Our high expectations of our own performance. Often, we experience shame. I know, especially in the early years before I found my own practice for self-care, there was this expectation that, had to be everything for everybody and had to be, have all the answers and know everything, and experienced a lot of shame as a result, because I didn't have all the answers, and I didn't always know exactly what to do in moments with clients, or exactly what they needed to help them achieve their wellness. And so I know for myself, shame was a big cause of burnout, never feeling like it was enough. Even it might depend on too the clientele that we work with. I know when I worked treating eating disorders, it is a very difficult recovery and a long recovery, and I would set these expectations of myself for helping clients to recover quickly, and that's not always the case. And so the shame, would kind of overcome, and instead of taking time for self-care, it would be this hustle to, try to be better or find the answer. So shame can be a big barrier or a cause for, pardon me, barrier to self-care, but also a cause for burnout for us. High expectations from others. So sometimes, sorry, I went to click on the Q&A because I had somebody, yes, so I've had somebody provide feedback, negative work context. So interactions with management is another factor. And that is true for a lot of people. If you're working in an environment that maybe doesn't support self-care, or maybe they verbalize it, but don't necessarily encourage it and recognize the importance of it, or maybe there's a management system where they're maxed out and maybe stressed themselves, so it's always kind of negative feedback and never the focus on what's going well and how you're doing well. And being in a negative work environment can absolutely be taxing, because I think it triggers a lot of different things. It could trigger anger, as a staff member. It could trigger shame if you're always feeling like, it's not enough, or you have to take on more clients, or there's no time for breaks or self-care, that you just have to keep going and see the next client. That can have a huge impact on burnout when you're not valued and recognized in terms of the work that you're doing. And that might fall in with, high expectations from others. So whether it's other staff members that maybe have high expectations of us, our clients sometimes come in and are hoping that we're going to have all the answers, and sometimes expect us to have all of the answers and what's going to fit and what's going to be right. And I know often parents, when they're really struggling with their child, or feeling helpless or hopeless, it's almost like they want you to come in and help and be, I don't want to say fix it all, but sometimes that's the feeling. And that can create huge burnout when those expectations keep coming and coming and coming. And even personal relationships. So sometimes, if you are also a parent and a spouse, and you have a social network of friends, often they have requests and needs for support and connection and all those sorts of things. And that can be very, very exhausting. If you are an EFFT therapist, what I found is, always staying in tune to the emotional temperature of the room, and following those nuances and processing the emotion when it comes up in the room. I've myself personally found that really, really, really exhausting. Not only does it require that mental focus, but it requires that connection to the emotion in the room and holding empathy. And you might be in the room with a really angry and hostile adolescent, and parents who are terrified or scared or frustrated themselves. And so to hold all of that emotion and process through it and help them, kind of work through it, that itself is exhausting. So you add that on top of maybe a huge caseload, or again, maybe you're dealing with a difficult demographic in terms of treatment. So addictions or eating disorders or those sorts of things, it can be really, really taxing on the self in all of the domains, but especially with the emotional kind of domain of self. And even just being a super feeler or empath. I'm going to make an assumption that some of you participating and watching can connect to that sense of being a super feeler and an empath. And it's often part of what makes us really great at what we do. But I think it can also be part of the burnout when, you know, we are genuinely feeling empathy for everyone that we're working with. And it's not even our clients. Sometimes it's empathy for a coworker and what they're going through, or our own family members. And like taking all of that on can be really, really, really exhausting. And, you know, it leads to the kind of the next point is sometimes as a super feeler or an empath, I don't know if you've ever noticed this, but sometimes we'll take on emotions that aren't even ours. There were days, or, you know, often where I might walk into work feeling really good and great, and then maybe meet with, you know, a family or a client and find myself afterwards feeling really sad. And, you know, it took me a while to figure out what was mine and what wasn't, but sometimes it didn't belong to me, but I was kind of taking that on. And we'll talk a little bit more when we get to the experiential strategies on how to identify and separate that. But I did find that for myself, that was, and some of the people that I supervise, clinicians I supervise as well, have identified that as something that created burnout, because it's almost like you're carrying around stuff that doesn't even necessarily belong to you emotionally. And I just have another Q&A. Yeah. So there's also some feedback in terms of the burnout, and it was, you know, similar to the lines of that super feeler empath, but constantly wanting to do your best, but feeling like, you know, maybe you aren't, and the emotions in the room were overwhelming, and kind of getting lost in that at times, which I think goes back to triggering sometimes shame for us. When we're struggling with managing all the emotion, feeling exhausted ourselves, and then that feeling of we're not doing enough, or not helping the family or the client, you know, as we should be, that can be absolutely taxing as well. So I mentioned earlier, and I do believe this is true, that most of us could sit and have a conversation. I'm sure many of you could even do a webinar on self-care, why it's important, you know, different tactics and strategies. And, you know, we get all these messages about make time for yourself, you're important, you can't pour from an empty cup, take care of yourself first. I even looked at the reason why I included that self-care kind of collage is the moment that I saw it, I almost got overwhelmed by it. And like that pressure of, you know, if we're in this field and we know all about it, then why aren't we doing it? And I'm not assuming that because you're participating, you don't have any self-care practices. Some of you may, but I do believe it's a common thing that we struggle with. And even, I know for myself, that's created shame. That whole, I know better, but why aren't I doing better? Or, you know, I'm not practicing what I'm preaching to my clients. And, you know, with the EFFT principle, going back to, you know, the principle of usually when we know better and don't do better, there's some sort of block, legitimate block, whether it's emotionally or there's sometimes just factual barriers to us practicing self-care. So again, I put down a couple of them, but I do welcome your feedback in terms of what, you know, have been barriers for yourselves in terms of implementing or a consistent practice for self-care, especially emotional self-care. One of them I hear a lot about and I've experienced myself is time. You know, sometimes we're waking up, you know, rushing to get the kids ready, rushing to get out to work, you know, trying to be on time, making sure you've got everything in place and maybe things scheduled for after work because, you know, you have a meeting or the kids have to be at extracurricular activities, and then you get to work and then you feel the pressure immediately because you have this huge client load and a busy day and it's back to back. And like sometimes time really, really is a barrier. And, you know, when we get to the experiential strategies, I included a few that are, some of them are even 20 seconds, because it is a reality. That time sometimes is a big barrier to, you know, having a consistent practice. We don't necessarily all have 45 minutes in the morning, or even on our lunch hours or between clients, to do a meditation or a grounding or whatever it is that we're needing for self-care. Sorry, I'm just clicking on the Q&A. Yeah, the work context doesn't always support self-care. That can be a big barrier. I know at times, you know, I don't want to speak negatively about agencies, but there have been places where I worked where they would have these messages, right? And they'd have these little newsletters about why we should practice self-care, but there wasn't the support in terms of creating time and space to do so. It was more of kind of an expectation. To be honest, sometimes it felt shaming. This is something that you should make time for, and yet we're not going to give you time to do it. So absolutely, it is so beneficial and helpful when we have a work environment that not only kind of gives these messages, make time for yourself, but that actually supports us giving time for ourselves. As a lot of you know, and probably have experienced, when there is that time and space to take care of yourself and attend to your own emotions throughout the day, and, you know, meet your needs, whatever they are, that we do work more efficiently. We're much more grounded. We're much more connected to our work. We tend to be less triggered by our clients, because we've had, you know, time and space to process our own emotions or do whatever we need for self-care. So work environment can absolutely be a barrier to practicing. Another one is avoidance. So I know for myself, as well as other clinicians I've spoken with, when we have, you know, crazy schedules and huge caseloads, and the expectations kind of keep coming from ourselves and externally, sometimes I've avoided it. You know, I don't necessarily want to stop and smell the roses, because sometimes it feels like it would be overwhelming. So the coping would just be to go, 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 go. You know, what's the next client? Keep moving, keep going forward. And it wasn't always conscious avoidance. Sometimes it was, but sometimes it was just subconscious avoidance of, okay, just keep checking off the things on the to-do list and, like, you know, keep going forward. And when I started learning EFFT and emotion-focused therapies, sometimes I did find connecting to emotion overwhelming, and didn't know or have kind of the skill on how to process through how I was feeling in a somewhat efficient way so that I could move on to the next client. So I would at times consciously avoid how I was feeling and tending to my emotional self-care. And that kind of can go in the same lines of fear. Sometimes there's a fear of, if I, you know, really go in and connect to what I'm feeling, I'm a little scared as to what I might learn or find out about myself. And, you know, it could be the fear of shame. I'm afraid that, you know, if I connect to myself, or if I stop and pause and take a moment, that maybe I'm not good enough, or maybe, you know, this isn't the right job path for me. So fear can be an interior or an internal kind of barrier sometimes to really tending to self-care. And fear of judgment of others. So again, we get all these messages about taking care of ourselves, but I've heard time again, not only from clinicians that I work with, but from clients, that there's this judgment, sometimes real, not just perceived judgment, of taking time, and that it might seem silly or self-indulgent or selfish to take moments to just be with the self or prioritize the self over our clients or family members. So sometimes the fear of judgment is quite real and quite not just a perception, that sometimes people are getting direct feedback that it's not okay. And shame. So sometimes, you know, again, just from different people I've worked with and in conversations having, there's this expectation at times, I believe we have of ourselves, or some of us have of ourselves, that, you know, we have to be whole, that if we're wounded, that's not a good thing. So we have to kind of have our stuff together. Sorry, this is going to be recording, so I'm going to try to not use any potty language. But there's this expectation we have of ourselves that we can't maybe show weakness, or that we're not allowed to struggle, that we just have to keep moving forward, and that there's this shame associated with needing healing ourselves, which is so human and so real, but sometimes this shame can come up and maybe be a barrier to us really connecting with ourselves and doing some healing work for ourselves. So I guess one of the things is too, if we're going to practice self-care, part of it requires us knowing when we're needing it. Some people have just a regular, consistent self-care practice that they implement into every day, and it's just kind of become a pattern and a habit. And again, if you don't have that consistent practice, part of what might be helpful is knowing when you're needing kind of a bit of self-care, or a tune-up, or a check-in with yourself. So knowing our signs and our triggers can be really helpful. And so kind of, you know, like we did when we started, I'm going to go through these questions slowly and encourage kind of checking in with yourself. And so in the beginning exercise, what I'm going to invite you to do is to close your eyes and just start connecting to your breath, trying to quiet out, you know, the thoughts or the to-do list. Just bring your focus and awareness to your breath and follow my voice. If thoughts come up, just to allow them to pass by, not needing to push them away or judge them, just imagining them floating by like clouds in the sky. And then bringing your awareness back to your breath, into your body. And then as I pose this question again, or these questions, to try to receive the answer, as opposed to, you know, intellectually searching for what's right or what you should say, but to try to, you know, really connect to the body and ground in the body and receive whatever answer is true for you. There's no right or wrong answers. And so we're just going to take a deep breath in through the nose and out through the mouth. How do you know when you're beginning to burn out? And just allow yourself to just absorb that question and receive whatever answers that come. They may be physical symptoms. You may notice you are more irritable with loved ones or colleagues or clients. You may notice more headaches, lack of sleep. What are your signs that you're beginning to burn out, or that you are burned out? And as you receive the answers, you can write them down. And if you're having difficulty receiving the answers, and the mind is kind of trying to take over, just refocus on your breath, trusting that you will receive the answers. And just write them down as they come. You may notice that your anxiety or your breathing changes when you're starting to burn out. You may notice your nutritional habits change. Just write down whatever is true for you. And then I invite you to take a deep breath in and exhale through the mouth. And to ask yourself, what types of presentations, specifically in clients, are most difficult for me? And just allowing the response without any judgment. For whatever reasons, we all have, just more difficulty sometimes with client presentations. Do you notice that, anxiety or fear presentations are more difficult or tend to exhaust you more emotionally? Is anger more exhausting, in terms of a presentation? Depression, hopelessness? And again, just receiving whatever is true for you without any judgment. And when you receive your response, to write that down. If the mind wanders, or is maybe starting to think about certain clients, to just bring your focus back to your breath, back to your body. Take another cleansing breath in through the nose and exhale through the mouth. And now ask yourself, how does my body let me know that I'm beginning to become emotionally burnt out? Is it a feeling that you get in your stomach, like knots? Is it a heaviness or tightness in the chest? Is it, pressure in the head, tightness in the shoulders or jaw? How does your body let you know when you're starting to become emotionally exhausted or that you're in need of some self-care? And if the answers or responses aren't coming, just continue connecting with breath and body until you receive what's true for you. And then we're going to end the exercise by just taking a deep breath in through the nose and out through the mouth. And then bringing your awareness back to the room and opening your eyes when you're ready. And if needed, just take a minute or two to jot down any answers that or responses you didn't get a chance to document when we were going through the exercise. And as you do that, you know, I just want to, I guess, to normalize and validate that we all have our own triggers, and we all are susceptible to emotional burnout, and that doesn't equate to being weak or not good at what we do, or you know, not being a good clinician. We all struggle, and sometimes the type of client we struggle with is based on our own triggers, based on our own life experiences. But just want to really normalize that this is something that we all experience, and to have awareness of it, but also to bring compassion to it, can also help with those barriers to doing our self-work. So when we can accept, you know, and acknowledge that, you know, I know for myself, I have, I would say, a strength in, you know, sitting with a client who is hopeless or depressed or suicidal. I don't get burned out from that, but I do struggle with, and still struggle with, highly anxious presentations. So again, whether that's a client or a clinician that I'm providing supervision or consultation for, that's still something that I find more exhausting. And, you know, to bring compassion to that, I've accepted it, I brought compassion to it, and that has helped me to be more likely to practice some self-care, because I do not have shame around that. So what, you know, I might invite each of you to do is whatever you wrote down for kind of what triggers you, is to, I invite you to bring compassion to that. That just acknowledging it and, you know, attending to it and not judging yourself for it can decrease, you know, the blocks or the barriers to practicing self-care. To help, you know, I do prep work when I know I have someone who's highly anxious that's coming into my office. And it's not a judgment on them either. It's just something that I've become aware in order to be really connected and grounded. In the presence of anxiety, I need to do a bit of work on myself. So now that we've identified kind of what some of the symptoms that you've experienced are, and we're all a bit different, we can move on to, you know, talking a little bit more about self-awareness. So we've been practicing it already throughout this webinar, just that tuning into the breath, connecting to the self. Because of, you know, the society we live in, we're often so focused on the external, right? What does my boss expect? What do my clients expect? What does my family expect? You know, what do I need to do to prove that I'm good enough? How do I please others? And so I think a huge and a very pivotal part of emotional self-care is developing self-awareness. And really, really connecting to ourselves and our breath and slowing down. One of my, I guess it might be a philosophical belief, is that I believe it about ourselves as clinicians, but also about the clients that I work with, is that deep down we know what we need to heal and to be well. And even, pardon me, with the strategies I'm going to introduce, you know, a little bit later on, I will always still say to value what you know works best for you. If you found practices that are helpful and energizing and balancing for you, to leverage those over what I might suggest. Because I think deep down, when we can connect to ourselves and start to trust that inner, whether it's wisdom or intuition or whatever word we want to use to describe it, that we know what we need. So I believe the self-awareness is integral to self-care, because for me, you know, I always laugh because one of the most common ones I've heard, you know, take a bath as part of self-care. That doesn't work for me. So I can go and practice that, but you know, it doesn't work in terms of what calms me, what balances me, where I feel relaxed, and all of those sorts of things. So we can have a list of million strategies, and even as I was preparing for this webinar, I was curious as to what was out there about self-care and felt so bombarded, and there were these really brilliant suggestions in terms of what to do. But there wasn't, I found anyway, there wasn't any guidance in terms of how to connect and develop self-awareness. So there was a list of, one of them was like 50 things to do for self-care. Say no, set boundaries, make the time, all these things that I think cognitively most of us know. But again, why don't we do it? And that's where I think that self-awareness comes in, to know, what is it that triggers me? How do I know when I even need self-care and to take a moment for myself? So that's why I've kind of integrated it even from the first, I think, 4 minutes of this webinar, because I do believe when we can learn to connect to ourselves and generate that awareness, that wisdom will come. Those responses will intuitively come in terms of what works best for us. And I just liked that quote at the center. Sorry, it's blocked off from my face. At the center of your being, you have the answer. You know who you are, and you know what you want. And for me, that's a fundamental belief. So that's why I've integrated a lot of the experiential and tuning in and self-awareness into self-care. So some of you joining may be EFFT clinicians. What I'm going to go through is kind of very briefly some of the strategies that we can use to help us, practice emotional self-care. I won't speak too long on the clinician blocks, because I do believe there's some participants who maybe don't practice emotion-focused family therapy. But if you are trained in EFFT, one of the ways to practice emotional self-care, or even just check in with ourselves, is to use the self-directed worksheets. And what that helps us to do is identify when we're triggered, specifically by a client and a presentation, and it helps us to work through kind of what emotions that triggers in us, and then how to work through that emotion and cultivate kind of a compassion and groundedness for the client. The second one that I'll spend a bit more time on and reviewing is the emotion coaching for self. That is one of the modules of EFFT, and it has the 5 basic steps. So what I'm going to do in the next slide is I'll go over the steps of emotion coaching, but how we can apply it to ourselves to do a bit of a check-in. There's another experiential that we'll practice, and I've just termed it the C.A.L.M approach. So that is a strategy that can be used, I believe, kind of quite quickly. I'll say about 5 minutes. That we can just, it's a way to, it's similar to the emotion coaching, but it's a way more to connect to breath and grounding, and how to work through difficult emotions when they come up throughout our workday, or even with our families or at home. And then the last portion is, I just referred to as tune in and tune up. And those are specific strategies that we can implement, in 20 seconds, like to a minute. And those I have found helpful, especially when working in agencies where there was, that expectation to have back-to-back clients, or if it wasn't back-to-back clients, it was meetings after clients, and sometimes working through lunches, and your next client's waiting while you're still with another one. So these were strategies that I found really helpful, just to kind of ground and center myself in the midst of a really busy and chaotic day. And so before I go into the steps of emotion coaching, just want to open it up to any questions about the content or anything that I've shared thus far. So I'll just give a moment for you to type them in if there are any. Okay. So the question, where are worksheets? Trying to think now, the self-directed clinician block worksheets, if you've done a training, you would have received them. What I can do as well is, trying to think, so this webinar is going to be recorded and accessible, and what I will see if we can do is send out the worksheets to everybody that participated, because I'm assuming you're referring to the clinician block self-directed worksheets. So I will see if I can get that sent out to all of the participants joining today. Just make a note of that. But again, if you did do any EFFT training, that would have been included in part of the curriculum and the handouts that you would have received as well. Okay, so some of you may be very familiar with emotion coaching. And for those of you who aren't, I'll go over it quickly. But what I did is I kept the same, call it steps in place. So for emotion coaching, when we're teaching it to parents, the main steps for emotion coaching are attend, label, validate, meet the need, and fix it. And for those of you who have practiced this a lot with other families, for the context of this webinar, as a strategy, I just put it in context to how we can use it with ourselves. So when it comes to attending, it's just noticing, what am I feeling right now? You know, where do I notice this in my body? Where do I feel tension? Am I, you know, feeling it in my stomach, in my chest, in my lower back, my shoulders? But it's just attending to, what is it that I'm feeling right now? The next step would be to label it. So is it, am I feeling angry? Am I feeling frustrated, ashamed, sad, scared? So just putting that label to the emotion. The next part is validating. And, you know, when we do it for ourselves, I think of it as self-compassion. So if I'm feeling frustrated with a client who maybe I've been working with for a long time and, you know, doesn't seem to be getting better, or maybe following suggestions or strategies that we've talked about, I can bring validation to that. I can understand. Sorry, I just noticed a huge printing error. My apologies. I can understand my feeling of frustration because, you know, I've been working really, really hard to support this client. And because, you know, we have gone over and I've done everything that I know in terms of my skills to help them process through, and yet they still don't seem to be engaging in any of the strategies, or they don't seem to be engaging in their own path towards wellness. So the validating is really giving ourselves the understanding of why we're feeling the way we are, really being compassionate with whatever emotion it is that's coming up. The next step is meeting the need. So what am I needing right now would be the question. And again, the needs may be familiar to some of you, but for those of you who aren't familiar with the emotion coaching strategies and the emotional needs, sadness needs comfort. Fear, so fear, not anxiety, but actual fear where there's a threat in the environment somehow. It needs safety or protection. Anger needs a boundary. That may be saying no to something. It may be just being able to, you know, assert in terms of what you need, like I'm needing more time, or I'm needing a smaller caseload. And then shame needs reassurance. So if I'm feeling shame and not good enough about a client who maybe isn't recovering in the time that they were hoping to, I can bring myself reassurance. right? I can understand why I'm feeling ashamed, because it's really important for me to be able to be helpful for clients, and I'm doing the best that I can, and I'm really trying to make sure that I give this person what they need. And then the last part is the fix it. So this is where we can ask ourselves, what is one thing I can do today to meet my need for? And then that's where you would insert either comfort, safety, boundary, reassurance. So, to kind of run through, if I'm feeling angry, my manager has expressed that they want me to take on more clients and that my caseload isn't big enough in terms of their expectations. And I'm feeling angry at that. So I would label it, I'm really angry at what I believe are these unrealistic expectations. And I can understand why I'm angry, because I'm doing the best that I can. I do have a very, very busy caseload as it is. And because it doesn't feel like a realistic expectation in terms of outcome. It sounds more like a clinical policy, kind of get things done. And if it's anger, the need is a boundary. So I'm needing to maybe really express to management, right, how I find that this is an unrealistic expectation, or I'm needing to be able to say no. And then what is one thing I can do today to meet that need? It may be having a conversation with the manager. It may be, saying no respectfully to management and explaining why. But that's one way that, if you're just feeling really overwhelmed by some sort of emotion, this can be, even a 4-minute kind of process where you just stop and check in and offer that emotion coaching to yourself. Any questions on how to use the emotion coaching for the self? I'll just give a moment for people to type in any questions that may be there. Sorry, I apologize. I just realized how fast that hour went by. So my intention was not to rush, but I will go a little bit longer so that we can go through the material, but I will go through these quickly for those of you who have to leave exactly at 1. So another strategy that you can use, my intention was to do this experientially, but because of the time, I'll just review it in terms of content. And the calm approach is closing the eyes, connecting to breath, and then connecting to whatever emotion is there. The next part would be to attend to that physiological experience in your body, accept that anger, the fear, the shame. And then the next step would be to set the intention to let it go. So I let go of this anger, and then on the exhale and the breathing, to envision the anger or the fear or whatever it may be exiting kind of yourself. And the next step is to manifest. So if you're doing this in between clients, this can be done quite quickly. Okay, I'm feeling stressed because my last client was really anxious, and now I'm feeling dysregulated. Okay, I'm going to connect to that anxiety in my body. I'm going to set the intention to let it go. On the exhale, I'm going to release it, and then I'm going to manifest what I need. So I'm going to set the intention on the inhale to bring in calm, to bring in a clear mind, and to just bring in that feeling of like love and acceptance and groundedness for the next client. So this can be a little bit quicker sometimes than the actual emotion coaching, and can be an effective way to process through the emotion without shoving it down. So the tune in and the tune up. I've spoken a little bit about how time is a huge, very realistic constraint for some of us. And so these are exercises that can be done, or strategies that can be done in about, like I said, 20 seconds to a minute. The hands on heart, again, they all have to do with connecting to self. So the hands on heart is placing your hands over your heart, closing your eyes, taking some deep breaths, connecting to the breath, and then envisioning something you love deeply. And it may be a person, a place, a sound, but just focusing all of your energy on that thing and breathing into your heart space. And that can be a really quick way to ground in between clients. Sometimes you can use it at any time during the day, but when you have a constant clientele and sessions, that can be a quick way to just connect to your heart and kind of ground yourself. The other, based on, in those moments when we're taking on maybe something that's not ours, an emotional experience, a state, sometimes people will say when I work with really hopeless clients or suicidal clients that they're left feeling very, very heavy themselves, but it doesn't feel like it's theirs. So one strategy that can be used is you can see my fingers there, to link your fingers and then to set the intention after that session. If you're feeling, like you're carrying something that isn't yours, close your eyes, connect to breath, and set the intention to separate yourself from that person's energy. And then you can feel a bit of a shift. So that's a quick strategy as well. Another one is, again, beginning with closing the eyes, connecting to breath, and asking, what does my emotional child self need today? And again, like we've been doing throughout, trying to get that response as opposed to searching for the answer. And then asking, what's one thing I can do today to meet that need? Other quick kind of strategies are, for protecting our emotional self. As some of us are super feelers and empaths, we can set the intention right before we even meet with a client if we know it's difficult, or maybe we struggle with anger and these are really frustrated parents. It's just setting that intention that, that I will not take on kind of these their presentation, that I will be able to connect with and empathize and help them work through it without taking it on myself. So that can be a way before we even meet with somebody to set that intention and consciously be aware of, their emotional state and not taking it on as part of our experience. And then grounding techniques. So a lot of, I don't know what you've noticed, but when we're overwhelmed and stressed and feeling all these emotions, like it feels like a lot of times we're all up here and like anxious in our chest. And what can be really helpful is to ground. And some very quick ways that we can ground. I have washing hands in cold water. Cold water is very, very grounding. So even if it's in between clients, going to the washroom and just, washing your hands under the tap, setting the intention to wash away whatever, it is that is not yours or doesn't serve you. Another quick strategy can be to plant your feet on the ground, place your hands on your knees or your thighs, close your eyes, connect to breath, and just envision as though you are a tree and there are roots kind of coming from your feet into the ground, keeping you firmly planted in who you are. And then just taking a couple breaths in that moment with that visualization of you being grounded and connected. And connecting to breath and the color red as well can be a quick way just to ground in between clients or before a meeting, or sometimes even if you're in a stressful meeting, you may not be able to close your eyes, but can just even place your hands on your thighs and envision kind of the roots going into the ground and being very grounded and connected in that moment. So I do apologize for, one, going over time, and two, going through those so quickly, but want to open up any questions or comments. And as people are typing kind of questions or comments, what I'm going to do is just go through kind of the wrap up really quickly. So if you want to provide us feedback, or if there are webinars, or if you're wanting a bit more on the other domains of self-care, you can feel free to email us at that email address. I noticed another spelling mistake. I did want to talk about the purpose of donations. So when you registered, you may have noticed a donate button. So our intention is to provide very low cost and free services and webinars and information with clinicians and parents. The donate button is simply to help us with our administrative costs. So for our licensing for Zoom and things like that, to be able to offer these. So we encourage it, if your heart is feeling open, to donate when you feel that it's right. I did want to announce we're going to have a new clinician webinar series that's going to be announced soon in terms of the context, but there'll be several of those coming out, and you can stay tuned through that at our Mental Health Foundation's website. And also wanted to announce, for those of you who are trained in EFFT, that the International, it says association, it's Institute for Emotion Focused Family Therapy, is now open for applications for certification. So if you go to that website, you will see the different areas that you can be certified in and what the qualifications are. So that being said, just going to check. I don't think there are any new questions. I think we're good. Again, I apologize for going over time, but want to thank you for connecting today, and hope to connect with you at another time, and hope that you enjoy the rest of your Friday wherever you are in the world. Take care.